What's up, everybody? My name is Pedro Cândido, and today we are here to continue with our course on the acid-base disorders. Okay, guys? Don't forget to leave a like, okay? Subscribe to the channel so you can always have our newest content, okay? And don't forget to activate the bell right below, okay? So you have a notification when a new video drops, okay? So today we are going to talk a little bit more of the metabolic acidosis with a high anion gap, okay? We talked about the cat mud piles, okay, that are the causes of a high anion gap metabolic acidosis, okay. But today I wanted to talk a little bit more about this, okay. And in the next video we will also talk about causes of metabolic acidosis with a normal anion gap, okay. So let's get a little bit deeper here, okay. So we have the letters, okay, the cat mud piles. So let's talk a little bit of each one of these, okay. On the C, we'll talk about, okay, carbon monoxide, okay, intoxication, cyanide intoxication, okay. We'll have several intoxications, the cat mud piles, okay. You'll see that intoxications are a great part of the causes, okay. And congenital heart failure, okay, in the neonates. Okay, so we are going to the A in the cat. We are going to talk about aminoglycosides, okay. It's a class of antibiotics, okay. It's an antibiotic drug. So in the T, we also have another causes of intoxications. Oops, what have I done here? Okay, we are going to talk about. Oops, where's my laser? Okay, here. We're going to talk about toluene. That is it's a component of glues. Okay, you can see here that there are people that are addicted to sniff these glues. Okay, so it's the glue sniffers. Okay, and the theophylline. Okay, another cause of intoxication. Now in the mud piles word, we're going to start with methanol. Okay, methanol. It's usually found on some beverages. Okay. Some alcoholic beverages that are not well made, okay. Some homemade beverages can end up with methanol instead of ethanol, okay. And the main symptom of methanol intoxication, it's blindness, okay. So if you have a patient with a sudden blindness with metabolic acidosis, you should think about methanol intoxication, okay, guys? And so going to the U word, we are going to have uremia, okay? So there's a lot of causes that can cause uremia, okay. So we can have some renal injuries, okay, that can be acute or chronic, okay. So we can have the AKI, the acute kidney injury, or you can have some chronic kidney disease also, okay. This will also cause a metabolic acidosis with uremia, okay. Just remember that the metabolic acidosis will be due to the kidney can't put hydrogen out, okay, if it's not working properly. So you'll have an accumulation of hydrogen in the blood of the H+ ions, okay, and we will end up with an acidosis. And so going up here in the D, we have we can say that it's one of the most frequent causes of metabolic acidosis with a high anion gap, that it's diabetic ketoacidosis. And we also have other causes of ketoacidosis, okay. As you can see here, we have the diabetic. Oh my god, I'm struggling here, guys, with this image. Okay, so we have the diabetic ketoacidosis, we have alcoholic ketoacidosis, and we have starvation ketoacidosis. Okay, alcoholic ketoacidosis and starvation ketoacidosis, it's a very similar pathogenesis. Okay, it's actually an starvation mode of the body. Okay, if we don't have enough glucose in the if we don't have enough glucose in the blood, okay, we'll end up with keto acids. Okay, and we'll end up with metabolic acidosis and the other things. Okay, so just remember, okay, always to look out if the patient is diabetic. Okay, you should ask for blood glucose always. Okay, in patients that you generally will, when you ask for a blood gas, an arterial blood gas. Okay, you should also ask for blood glucose. Okay. Okay, in the P, we are going to talk about some drugs. Okay, paracetamol or acetaminophen. There's a byproduct of the metabolization of paracetamol that will increase, okay, the anion gap. Fenformin and paraldehyde, okay, are other causes. In the I, we'll have iron isoniazid, okay, it's another drug. And inborn errors of metabolism, okay. There's some mitochondrial diseases also that can end up in this. And in the L, we'll have lactic acidosis. Okay, we can have lactic acidosis for hypoxia or hypoperfusion. Okay, you should always remember that. In the E, we'll have ethanol. Okay, due to the lactic acidosis. And it's ethylene glycol. Okay, it's another cause of intoxication. Ethylene glycol, it's an anti-freezing agent. Okay, it's usually it can be used on several industrial processes and somehow can end up in food, beverage. Okay, and will cause an intoxication, causing a metabolic acidosis with a high anion gap. And just to finish, we'll have the salicylates, okay? And among the salicylates, the most important one will be the aspirin, okay? The acetyl salicylic acid. So just to finish here, guys, let's make a question, okay? We're always doing questions, okay? In exogenous intoxications by salicylates, okay? We just talked about that, okay? The following is found. Metabolic acidosis with elevated anion gap. Of course, guys, it's the topic of our class here. So this is our answer. Let's go to the other ones. Metabolic acidosis with normal anion gap? No. Okay. Contraction metabolic alkalosis? No, it's a metabolic acidosis. Respiratory acidosis? No, it's metabolic. Mixed normal chloremic acidosis with normal anion gap? No. Okay, guys. So this is all for this class. Okay, it was a quick one. I hope you enjoyed the class. Okay, forgive me for my English. I'm giving my best here to bring you this content, and as I practice, I'll get better. I promise. Okay, guys, don't forget to leave a like and subscribe to the channel. Bye bye. See you on the next class.